All right. Well, as we continue to admit people and introduce ourselves, I'd just like to introduce the Learning Collabs with this intention screen. So, the purpose of the Learning Collaborative is to create and sustain a learning community that raises awareness and inspires personal and collective growth. These meaningful engagement opportunities aim to ignite participants to contribute to transforming systems that foster community wellness. So, we really appreciate you all being here. We appreciate your engagement in today's discussion, and we're excited to invite or to discuss today's topic. Um, and so today's topic is bridging the healthcare workforce gap, strategies in recruitment and retention. So as many of you may know, Greater Health Now has a commitment to workforce development, and we collaborate with cross sectors throughout our region to develop projects related to workforce. So we are excited to have our wonderful speakers today. We like to recognize that Greater Health Now is committed to being a neutral convener, bringing experts in their field to provide real-time information about current topics. And in the evolving landscape of healthcare, we are often learning alongside our audience and are unable to predict what the future will hold. We know that every organization's path is unique, and in no way are we recommending or endorsing a single pathway as it relates to this topic. Thank you for being here today and for engaging with us. So these are the learning outcomes for today. We have 3 presentations and each has a learning outcome here. So first, we'll be able to identify recent recruitment and retention strategies from Washington Health Workforce Sentinel Network. We'll learn about strategies for recruitment and retention and being recruitment and retention from the Behavioral Health Institute. And we'll comprehend how to use the SUD Organizational Development Assessment to identify organizational strengths and challenges. So our lineup today will have Benjamin Stubbs from the Washington Health Workforce Sentinel Network will kick us off. And then we'll shift having Cheryl Schwartz with the University of Washington Medicine Behavioral Health Institute. And then Melina Stott and Tasha Irvin will finish us up from Principal Allies. So I will go ahead and introduce our first speaker here. Ben Stubbs is Deputy Director of the Health Workforce Research Center for Allied Health at the University of Washington Health Studies and the Program Director of the Health Workforce Sentinel Network. And Ben, I will go ahead and let you share your screen.
Okay, great. And pull that up here. Okay, hopefully you're seeing my title slide.
Yes, we are.
Great. Thanks for that introduction, Danny, and thanks for having me here today. As Danny said, I'm Ben Stubbs with the University of Washington Center for Health Workforce Studies, and I'm here to talk to you today about a project that's been ongoing in the state since 2016 called the Health Workforce Sentinel Network. And so I'll tell you a little bit about what that is if you haven't heard about it before, and give some summaries of findings recently, especially regarding what employers are saying about their recruitment and retention strategies for healthcare workforce. But before we get into that, hopefully this works. Danny, were you able to program the Zoom poll?
Yes, let me launch that now.
Okay, great. We're
So
going to do a little, yeah, go ahead.
you should see a poll pop up on your screen, and I'll let you, is everybody seeing that? Perfect.
So I just want to get a little information about your experiences with the Sentinel Network in the past. So this is a question to sort of gauge how have you interacted with, or what do you know about the Sentinel Network? So I'll give you about a minute to check the box or two, and then we'll look at the results. are we looking on results, Danny? Is it kind of slowing down?
Yeah, it looks like it is slowing down. So about 54% have not heard of the Sentinel Network before today. 19% have heard of the Sentinel Network but haven't interacted with it in the past. 14% have promoted the Sentinel Network through emails, newsletters, direct communications, or other methods. 8% have provided workforce demand data by completing the online questionnaire. 16% have viewed or used the dashboards on the Sentinel Network website. 19% have viewed the findings briefs on the Sentinel Network website. 14% have viewed a presentation about the Sentinel Network prior to this one. And 3% have used findings from the dashboards or briefs to inform planning for my organization.
Okay, great. Thank you all for sharing your experience there. That's helpful to know, and great to hear that there's a variety of experiences, including some of you have never heard of the Sentinel Network before. So that's great too. I'm here to introduce you to it and tell you a little bit about it and share some findings. And for those of you who have interacted with the Sentinel Network, especially if you've filled out the questionnaire in the past, I really thank you for your engagement and work in sharing your experiences. So we'll talk through some of the findings that you and others have shared in the past. So before I get into those findings, I want to give a little brief background about the Sentinel Network, especially for those of you who have not interacted with the Sentinel Network or heard about it in the past. So the Sentinel Network is a partnership between the Washington Workforce Training and Education Coordinating Board and the University of Washington Center for Health Workforce Studies. And ongoing funding is provided by the Washington State Legislature. The goal of the Sentinel Network is to allow employers to share their health workforce needs. And so what we're really interested in learning is from healthcare employers across the state, what are the challenges they're experiencing around hiring and retention, training, and other important issues regarding their workforce. And in many cases, what are the solutions that they're testing out or that are working for them that they can share with other employers and planners around the state. So it's really meant to be a network, as the name implies, that connects the needs of employers to the planners, educators, and policymakers in the state who can provide support and help them solve the problems that they have or the challenges that they have. It's a statewide effort. We now open an online questionnaire once per year, and the goal is to reach all sectors of healthcare, from oral health to hospitals, behavioral health, primary care, even some veterinarians have participated in the past. So really trying to reach all sectors in the state. So as I mentioned, the goal is to understand health workforce needs, primarily from the employer perspective. But really, it's also, there are some sources of information around like vacancies or occupations that are in high demand in the state. And those often provide a good source of information about, vacancy rates or the number of job ads recently for different occupations that can give you an idea of what are the occupations that employers are having difficulty hiring. But often those numbers kind of are lacking a little bit of the context or the how and why. So why is it that employers are having trouble hiring certified nursing assistants, for example? And so the Sentinel Network is meant to fill that gap and provide some of that information that can be lacking in those really quantitative data sources. So we like to say it provides the how and why behind health workforce needs. And the goal is to identify signals that can then be communicated to planners and policymakers and educators, and then inform solutions and really is meant to help solve problems and um, and and help employers and others address the challenges that they're facing around healthcare workforce. As I mentioned, the questionnaire is open online once per year. And in fact, as I'll mention several times throughout, we're currently in the data collection period now. We're collecting information from employers until this Friday, May 30th. So we're interested in hearing from more employers by the end of this week. But the questionnaire casts a wide net in that, as I mentioned, we're interested in hearing from all healthcare sectors. So there is a list of over 30 facility types that respondents can select from and indicate what healthcare sector they're representing. There are over 80 occupations and then multiple opportunities to write in other occupations. And it is meant to cover the entire state. And we report the findings based on accountable community of health. So the map you see here shows those healthcare planning regions. And so that's how we report the data. And it really is meant to capture information from across the state, but also allow regional understanding of health workforce challenges. So what are the questions we ask about each year? We ask employers to tell us about the occupations that are experiencing exceptionally long vacancies in their organization, what occupations are experiencing turnover. And then, as I mentioned, the real goal is to understand the how and why behind this. So we ask open-ended questions and ask employers to let us know, why is it you think that these certain occupations you're having difficulty recruiting or retaining? Then each year we ask what we call overarching questions, which is a series of 4 to 5 questions on topics of interest. So we work with our advisory committee and other stakeholders to identify topics that they think are important to know and to understand from employers. And so each year those questions change and are meant to give an idea of some of the most important issues or the current topics of interest. Then we also develop sector-specific modules to give a deeper dive into some sectors of the healthcare workforce. And so, for example, this year we have a series of questions that if the respondent answers that they represent an organization that provides behavioral health services, we ask them a series of questions about peer counselors and their experiences with that occupation. We also have a module this year for oral health providers. So if they answer that they work in a dental clinic or an FQHC that provides dental care, then there's a series of questions related to their experiences with their workforce. Then finally, we ask respondents to self-report if they serve primarily urban, rural, or a mix of urban and rural clients so that we can understand some of the issues specific to those areas of the state. And as I mentioned, the focus of all of this is on qualitative input to really understand the how and why behind the numbers that one can find with many other data sources. So once those data are collected from employees, we really try to make sure that they can the findings and the information shared is distributed as widely as possible. And one way we do that is we make all of the answers available on our website, which you see listed here, www.wa.sentinelnetwork.org. And on that website, you can see responses broken down by facility types. So if you're representing a specific sector, healthcare sector, you can see what others in your similar situation are reporting. And in some cases, as I mentioned, see solutions that they're trying and they're finding to be successful. You can look by geographic region, and as I mentioned, we report by accountable community of health. So if you go on the dashboard and click on one of those regions on the colored map that you see there, it'll zoom in on that region and you can see responses specifically from employers in that region. And then finally, we break it down by rural, urban, again, self-reporting, so that one can see what are issues that, for example, healthcare facilities that serve primarily rural residents, what are issues that are specific to them. In addition, after each data collection round, we create 3 to 4 page findings briefs, and this is meant to be kind of a high-level summary of what we, as at the Health Workforce Sentinel Network, have identified as some of the top-level themes. And we usually break these up by facility type. So as you can see in this last data collection round, which was spring of 2024, we created findings brief for behavioral health clinics, dental offices, etc. And so that's a good place to start, especially if you represent one of those organizations or have partnerships with those organizations, and you can see what other employers have reported as their health workforce needs. So how has the Sentinel Network been used in the past? It's been used extensively in the behavioral health realm. There were several reports that were prepared and reported to the governor's office and the legislature in the last several years. And the Sentinel Network was used extensively to inform those reports. It's also reported annually by the Health Workforce Council in their annual report. And so those are meant to provide high-level summaries of findings from the Sentinel Network. But additionally, it's been included in testimony during multiple Washington State Legislature committee meetings. And for example, one of our really active members in the Sentinel Network, Renee Fullerton, is now a member of the Children and Youth Behavioral Health Working Group through the Healthcare Authority, and that organization or that group advises the governor and the legislature about behavioral health issues related to children and youth. So Sentinel Network is informing that work. It's also used, and we're trying to partner with the accountable communities of health to make this information as useful as possible. So thank you, Greater Health Now, for inviting me here again to be part of this learning collaborative, and the partnership, especially with Greater Health Now, has really been a strong one throughout the history of the Sentinel Network. So we would definitely appreciate that support and hope it can continue. We also work with community college health programs, HR directors, professional organizations, etc. And then since the data are publicly available, as some of you mentioned in the poll at the beginning, some of you mentioned you have used the information to inform some of your work. And so I'm positive that things are happening that we don't even know about, which is great. That's part of the goal of the network, is to make this information available to all who need it. So traditionally, how do we encourage people to participate in the Sentinel Network? Our main strategy in the past has been to identify trusted leaders. And so those are leaders in organizations that have connections to these healthcare organizations that we're interested in hearing from. And the theory there is that an email or a newsletter or just a personal communication from leaders that these trusted organizations are likely more effective than just an email coming from me at the University of Washington. So we've really worked to establish those connections with organizations around the state that have partnerships and work closely with healthcare employers, so that we can understand what the needs are and make that information available to those who need to hear about it. We also, of course, keep contact information for people who have filled out the questionnaire in the past. And then each new data collection round will send direct emails to them, asking them to fill out the questionnaire again. And then another strategy is to really just work hard to distribute the findings as widely as possible. So that involves attending webinars such as this one, attending HR specific meeting groups, leveraging those connections with trusted leaders to understand what questions do you have and how can we help you answer those questions, et cetera. And then in addition, making all of those findings available on the website, we hope really indicates that this isn't an effort to just collect information and keep it closed. It really is an effort to share that information and make it available as widely as possible. So as I mentioned, we're currently in our 2025 data collection effort, and that goes until May 30th. So there's till the end of this week, we're hoping to hear from more employers. So I'd like to extend an invitation to any of you who are on this call that if you feel that you represent an organization and have information you'd like to share about vacancies, turnover, or just other general workforce challenges you're facing, please take the time. It takes about 15 minutes to fill out the questionnaire and can be shorter in many cases. Here is the link where you can join. If you are maybe place yourself more in that trusted leader box and are partners with organizations that hire healthcare workers and have challenges that you are interested in hearing about. I'd also encourage you to reach out to those groups and tell them about the Sentinel Network. Let them know that they have until the end of the day on Friday to share their information and encourage them to participate in the Sentinel Network. I have some recruitment language that you can use if you do want to reach out to your partners, and I'll post that in the chat here in a second when I have a chance to do that. I'll post it later, kind of near the end of the presentation. And if you're interested in using that to reach out to your partners, I really encourage you to do that. So I'll pause there for a second. That's a lot of information. Want to see if there are any questions or clarifications I can provide at this point before launching into some of the recent findings from the Sentinel Network.
Thanks, Ben. It's Nicole from Greater Health Now. All great stuff. I always appreciate hearing from you. I had a quick question about Renee and her current position and what she's advocating for. If folks or don't in their certain region, if they don't feel like they're being the information is misrepresented or they have questions about it, could they reach out to Renee and set up a time to meet with her?
Of course, yeah. I think that she's usually very open to hearing that feedback, and I think she would be interested in that. And you're welcome to reach out to me, and I can connect you with her if that's easier. So I think that would be great. Yeah.
Perfect. Thank you so much. It's also great to hear that she is in that position and there's that conversation happening. I know I appreciate that.
Yeah, I think it's great that she has such a great breadth and wealth of knowledge that I think it's great that she's been asked to do that and can contribute positively to groups like that for sure. Okay, we'll have time for more questions at the end in case any more come up. But before we go on, before I share some of the findings that employers have shared in the last year or so with the Sentinel Network, I want to ask you all to share in the chat, if you could, What are some of the top workforce challenges at your organization or an organization you partner with? And just want to get a feel for what you all are experiencing or what maybe anticipate you may see in the findings that I'm going to share shortly. So if you could just take a minute or two and share that in the chat. Okay, seeing a few things coming in. Competition with local hospitals make it hard for outpatient clinics to compete. Oh, the link is giving me an error. Okay, I'll try to repost that link in just a second. Sorry about that. So increased competition along combined with reduction in insurance compensation. Okay, so definitely funding and payment issues. Not enough spots for students to enroll in higher ed programs. Okay, that's something we've heard in the Sentinel Network. Capacity to care for all those in need of care services. Okay. Expected wages are well above what we can pay. And reimbursement rates are decreasing July 1st, so not sure about the future. Difficulty with retention for high demand positions and retention due to rural area pay, so issues specific to rural areas. Well, thank you for sharing all of that. That is definitely those definitely align with a lot of the findings that we've heard over the years and recently in the Sentinel Network. As you see, some of those themes will come through in the findings that I present here. Let me try, so with the link to the questionnaire, let me try putting in the direct link, and you could try copying and pasting that into your browser and see if that works better for you. Okay, so let's continue with some of the findings. As I mentioned, the part of the goal of the Sentinel Network is to also understand successes. So could you take 1 minute maybe to share, have there been any successes around recruitment and retention at your organization recently that you'd be willing to share?
I'll jump in.
Yes, thank you.
I'm not hiring anyone, but I'll say I am more particular about the environment I work in, and that has a lot to do with my decision on where I work, and that will be a forever thing going forward. I think I'm a better asset to the organization if I'm um, feeling like I'm supported. I can better support them, and I just think it's a better match. So company culture and environment is almost as important to me as the wage.
Yeah, that's interesting to hear. That's something we've heard from the employer side too, is that many employers are trying to emphasize the cultural uniqueness of their organization, maybe some flexibility in scheduling if they're able to provide that. So really trying to emphasize, the traditional recruitment uh, uh, practices, include higher wages and benefits, but also emphasizing some of those really important aspects around culture and flexibility and things like that. So that is something that we have seen from employers too. So thank you for sharing that. That's important to hear about. Let's see what some of the other folks have said. Posting for a work from home remote position netted us many more applicants. So again, that sort of flexibility can lead to success if you're able to offer that. Mental health care services have increased in the last few years, becoming more available to those in need. So yes, that's a great success. Thank you for sharing that. Community coming together to collaborate. Oh, that's great to hear about. I'm sure a lot of work goes into that to gathering the community, but can lead to a lot of success. We have developed a medical assistant program that allowed a great stepping stone for our reception team, but then that creates challenges with our reception recruitment. Yeah, so good point. You can help people level up and reach that next step in their career, but then still have the challenge of filling the spots that they vacated. So that's great to hear that the leveling up is working. In-house training of EMT has led to part-time EMTs from the students and from instructors. Okay, great to hear about that. Definitely agree with the previous comment. In the past roles on the job, apprenticeships were highly successful in the rural area, building on internal pipeline for talent. So yeah, a lot of work going on in organizations to promote people internally and also train folks to take on that next step in their career. So that's really great to hear about. And as you'll see shortly, that matches with some of the findings that were shared by employers in the past year. So thank you for sharing that. I'll kind of move on and share some of the recent findings from the Sentinel Network. So as I mentioned, the last data collection round was about a year ago in the spring of 2024. So keep that in mind as you're listening to these results. We're really interested to hear what people share this year and to see if things have changed or how much has stayed the same. But based on what we heard about a year ago, one of the high-level findings that came through the responses we got was that lower wage occupations were especially difficult to hire and maintain. And due to some of the issues that were mentioned before by some of you, that, for example, there's competition for workers. Some sectors are able to pay more for those lower wage occupations than others. And that leaves the employees with a choice, and they often pursue, the understandably pursue the wages that are higher, the workforce culture that works for them, et cetera. So as I mentioned, one of the great things about the Sentinel Network is the depth and qualitative nature of the information we gather. So here are a few quotes related to that. An assisted living facility cannot compete with hospital wages. So that matches what we've heard a little bit before. Many CNAs will only work in assisted living to get the experience they need and get hired at a hospital and quit. So that retention piece is a challenge as well as the initial hire for this person, this organization. Regarding medical assistants, we cannot compete with hospitals who are offering higher wages, bonuses, and benefits. We are looking for MAs who instead value our culture and align with our mission. So matches some of the comments we've heard before. Related to nursing assistants, high turnover, unable to keep staff as many continue their education. So, you know, some nursing assistants are pursuing higher education, and then it's hard to replace them. In some cases, what we were finding last year was that some employees were switching out of healthcare altogether. So some quotes related to that. There have been many people that have left healthcare. There are less people interested in working with people who might be ill. And so reading between the lines might be kind of a lingering effect from the COVID pandemic, and people making choices about where they want to work and deciding they want to work in maybe a different field. A second quote related to that, we lost several full-time staff during COVID, and they chose not to return or to return only as an agency contract. So again, finding about a year ago, finding some lingering effects from the COVID pandemic. Another high-level theme we found last year was that contract or travel workers are used less than they were during the pandemic, but are still a solution that many employers go to fill their staffing needs. So we asked a question, how would you describe your facility's use of contract travel workers now compared with your use a year ago? So again, remember they're answering in spring of 2024. So the way to interpret this graph, the blue is we did not use contract or travel workers a year ago and still do not now. So about a little over 50% of respondents overall were saying that. The orange is we did use contract workers a year ago, but do not now. So only about 2% overall said that. The gray, dark gray, we've decreased the number of contract travel workers. So the rest of the pie is those who say they still use travel workers, but the gray say they've decreased compared to a year ago. The yellow says we use about the same number as a year ago, and green, about 11%, we've increased the number. So overall, a little under 50% say they use contract for travel workers, and about, equal number, more or less equal numbers have decreased and increased and used about the same number. But if we look a little more in depth at different sectors, the answers varied a little bit. So if you look on the left, behavioral health facilities, there were about 50 responses in 2024. Most of them said they did not use contract travel workers a year ago and still do not now. However, if you look at small hospitals, so hospitals, primarily critical access hospitals with 25 beds or fewer, all of them said they were at that time using contract workers. About 50% said they had decreased compared to a year ago, but it was still they were still reporting that as a solution that they were relying upon. So one last high-level theme from rural serving respondents. So we heard a comment, one of you shared that the hiring in rural areas can be especially difficult. So some employers shared more about that. Many mentioned the perception that rural locations are less desirable for many healthcare workers and their families. So a quote related to that, our area lacks housing, public transportation, and daycare services. There are also limited job opportunities for spouses and limited activities for children. So that's something that we've heard consistently since over the time of the Sentinel Network, those are challenges that can be found in other areas, but are especially difficult in rural areas. Some employers have developed really creative strategies to attract workers. For example, one rural health clinic mentioned that we try to offer other types of benefits compared with other clinics, and our culture and mission is something unique that resonates with certain people. So again, mirroring some of the comments you all shared, some employers are really trying to talk about those really unique aspects of their organization and how those can be really attractive to many prospective employees. Another issue that many rural employers mention is that there can often be a lack of local training opportunities for people who are trying to get into a new job or for those who are trying to advance their career. And so some employers have developed their own programs similar to some that maybe you all have mentioned, and worked to bring in new trainees or to upskill their current employees. But the success of those quote unquote grow your own programs was reported to be somewhat mixed. And this mirrors a comment that you all shared recently. We train our own community health workers, but due to short staffing in nursing and medical assistants, we can only hire a few at a time. And we need more training that is not dependent on our existing staff to get them ready to work. So kind of similar to a comment we heard before about training receptionists or administrative staff to move into medical assistant roles, then you have a problem filling the receptionist roles. Another side of that is that it takes time of current employees to run these training programs. And so how do you balance the future benefit with maybe the current difficulty in using the time of other employees to do that work to train and bring people aboard. So one last section of findings I'd like to share. As I mentioned, one of the things that Sentinel Networks allows is you can zoom in on findings from specific regions. So this next section will highlight some findings from employers from the Greater Health Now region, so the 9-county portion in the southeast of Washington State, which you're all very familiar with, I'm sure. And so let's see what some of those employees shared recently. So this is combining responses from the last two data collection rounds, spring 2024 and fall of 2023. And as you can see, combining those two, Greater Health Now had the highest number of responses. So as I mentioned, that partnership has been very strong and hopefully can continue. So good number of responses here. This is a little bit busy, but the main thing I want to point out is that of all those responses, they came from a wide range of healthcare sectors, especially behavioral health, long-term care, FQHCs are the top three. But then also a very high representation from employers who said they serve rural clients or patients. So close to 50% said they've served primarily rural. So I think that's an indication of the general kind of geography of the region, but also the fact that it points to the fact that the findings we'll see from the Sentinel Network can really emphasize some of the challenges that rural serving organizations are having, and in some cases, some of the solutions. So looking at the top occupations across all healthcare sectors in Greater Health Now, the top occupation that employers reported having difficulty hiring was a registered nurse, followed by mental health counselor and physician surgeons and medical assistants. So you can see here, you can get kind of an idea of what are those occupations that that employers in the region are having trouble hiring. But then, as I mentioned, the really great benefit of the Sentinel Network is understanding why is it that people are having trouble with hiring those specific occupations. And additionally, we can look more closely by sector. So if we look at behavioral health facilities, the top occupations were substance use disorder professional, mental health counselor, and marriage and family therapist. Long-term care facilities, registered nurses, nursing assistants, and social workers. And if you see, you can see there are four tied as the fourth highest. So if the same number reported the occupation, it's listed as tied. It's a ranking rather than the number of responses. So you'll see here public health, Three occupations tied for the top reported as difficult to hire: registered nurse, physicians, substance use disorder professional, and FQHCs, registered nurses, physicians, surgeons, and social workers, but also see on this list substance use disorder professional. And we'll hear some presentations later today related specifically to substance use disorder professionals. So just wanted to point that out as a need that was reported in the Greater Health Now region. So now to the how and why. If we look at comments from employers who said they had difficulty hiring registered nurses, there were reports of competition among employers for a limited number of RNs, which can lead to nurses requesting high wages or specific working conditions. So again, interestingly, mirrors some of the comments we heard earlier from all of you. And there are some quotes here related to that. The first quote saying, basically there aren't enough RNs or LPNs available in our county, and our hospitals, nursing home, and clinics just steal from each other, in this person's opinion, and the staff rotate from one location to another. So lots of competition for a small pool of employees. Another comment: many hospital nurses are used to working 3 days a week, and they do not want to switch to 5 days a week at a community clinic. So that preference for scheduling can lead to difficulties in certain sectors or certain facility types. And all facilities are competing for the same applicants. The highest dollar seems to win, and employees will do fill-in work at a number of facilities and not commit full time to any one facility, according to someone at a skilled nursing facility. Another set of responses related to rural areas is additional challenges reported there related to hiring registered nurses. That one person says, I really like the idea of apprenticeship programs, hosting students, and potentially some additional programs that offer tuition assistance. I am interested in ways to recruit and host people from other countries. So really trying everything they can to bring in new folks to their organization. Then a final quote related to registered nurses: we lost several full-time staff during COVID who chose not to return or return only as agency contracts. So we saw that quote earlier. But additionally, added more context where facilities are often in remote locations where housing can be a concern as well. So lots of challenges specific to rural locations. Looking at mental health counselors, similar wage competition as we saw with registered nurses, plus some issues reported around licensing and the need for specific skills. So, for example, first quote around wages, the second quote saying many mental health counselors were unable to work because even though they completed their work requirements for licensure and had submitted the licensing application, it was taking many months for licensing to become approved. So that was something we were hearing a little over a year ago, and we'll see if we get similar responses this year. People without independent licensure are interested, but the state is behind in doing their paperwork. Our high needs clients are often not appealing to people looking to do lower acuity counseling. So several issues mentioned there. And then finally, we're seeking counselors with specific skills to treat youth and bilingual folks. And related to medical assistance, some have instituted internal grow your own programs for medical assistance. So a few quotes around that. The first quote indicating that the college that has the nearest college with a program to train medical assistants is more than 30 minutes away. So it's difficult for people to commute and do that training. The third quote is that this is a very high demand position. We've partnered with a state program to administer an MA apprenticeship program, and great success, but we're still having trouble hiring as many MAs as we need. And then finally, dental hygienists. about a year ago, many dental employees were saying that they're still facing challenges related to the COVID pandemic, and that dental hygienists were especially difficult to hire. First quote, I think, summarizes a lot of the information we heard, that there's a shortage of dental hygienists in Washington. Many of them have retired and left the industry after COVID. Hygiene classes are too small, and that average hygienist only works in the field for 6 to 7 years. So lots of lots of issues, difficult things to address mentioned there. And then two more quotes there, which I won't read, but talk about similar issues. So that's all I have to share today. Wanted to pause and see if there are any comments or questions based upon what I shared. And also to ask if you were able to try out the link that I posted to the chat, and if that worked better to get to the questionnaire than the original link that was posted. So any comments or questions?
This is Anna from Greater Health Now. I have a quick question. I know this is from the earlier data from spring and last year. I'm curious if you're hearing any whisperings of how the new environment is changing some of these hiring concerns.
Yeah, I haven't had a chance yet to look at the responses we've gotten this month. But one of the things we heard from our stakeholders and even just reading the news is that there's a feeling that the environment has switched a little bit more away from a focus on shortages to, in some sectors, having to reduce workforce due to funding issues. And so we're anticipating that this round we may hear a lot more about that. I think, difficulty hiring enough people is still going to be an issue, but I think we're also going to hear about the need to let people go or reduce workforce sizes just due to the very difficult funding situation right now. So that's one big change I anticipate. Thank you for that question. Any other thoughts or questions? Okay, well, if there are no other comments, I'd like to thank you very much for allowing me to share about the Sentinel Network. Hopefully it provides some information that's helpful. And also just one more plug, that if you are able to share information about your organization or encourage others, the current questionnaire is open until the end of the week. It closes on this Friday, May 30th. Here is the chat link to the questionnaire. I'll put the direct link again in the chat, and I'll also post some language that you can use to distribute to your partners and encourage them to participate if you don't feel that if you have those connections and feel that you have other organizations that you'd like to hear this information from. So I'll post those two things in the chat and say thank you, and then I think we'll move on to our next presentation.
Thank you so much, Ben. We really appreciate it. Such rich information, and really appreciate your time. And someone did say it looked like that new link was working. So the link in the chat for the survey was working. So that's great. And I will go ahead and introduce our next speaker, Cheryl Schwartz. Cheryl Schwartz is a project director at the UW Medicine Behavioral Health Institute at Harborview Medical Center, where she partners with governmental agencies, community members, nonprofit organizations, and other UW units to develop and implement innovative programs that grow, strengthen, and diversify the behavioral health workforce. Before joining BHI in 2021, Cheryl worked in a variety of public health roles with a focus on mental health promotion, chronic disease prevention and control, healthy aging, occupational health services, and the prevention and control of communicable diseases. The common theme in all of her work has been close collaboration with public and nonprofit organizations to promote the overall health and well-being of individuals, families, and communities. So we're very excited to welcome Cheryl to hear more about the Recruitment and Retention Toolkit. And Cheryl, I will let you go ahead and start sharing your screen. Let me stop sharing here. And there you go.
Sorry, I kept myself muted. Hi, good morning. Are you guys seeing the right screen? I don't see it. Oh, wait a second. Oh, I see. It says that you've started sharing your screen, Danny. On my, it says Forrest has started screen sharing. Oh, maybe it means it says I cannot start screen sharing. I think because you are.
Oh, it just says Cheryl Swartz has started screen sharing.
You know what? It's one of us is
So
that.
see if that.
I'm gonna try, it says I cannot start screen sharing while the other participant is sharing. Ah. Since you have my
Well,
slide.
Cheryl, would you like me to? Yeah, I'll just share my screen. That works.
Okay.
And just let me know when you're ready.
Great. Let me, then I can put mine in. Okay. Let me get mine. Okay, that looks fantastic. Good morning, everybody. Thank you so much for coming to this presentation, to learn more about the new recruitment and retention toolkit. And Ben, your presentation could not have been a better springboard. Some of the things you said in the second half of the presentation and some of the comments in the chat really highlighted the kinds of topics that I'm going to be talking about. So next slide, please. I'm not used to having someone else controlling the slides, so I'll do my best to remember to ask for that. So, so the recruitment and retention toolkit, before we get going and kind of telling you a little bit more about how we developed it and whatnot, I want to give just a little bit of background, and that's that the Healthcare Authority, which is represented in this call by Todd Jensen, and probably many of you know him and others from the Healthcare Authority, asked the Behavioral Health Institute at UW Medicine to create a recruitment and retention toolkit that's pretty basic, kind of 101. Some of the stuff will be very familiar to you and you'll be like, oh yeah, we've been doing that for years. And some of it'll hopefully be kind of new and some interesting ideas to consider. But the idea was really to try to get the behavioral health providers around the state some are working on old processes and protocols and forms back from the 70s, 80s, and 90s, and some are using the newest, technologies and approaches from the 2020s, and the idea was to kind of level the playing field and provide some basic current norms around retention and recruitment, which is such a difficult situation in all the healthcare fields, but particularly perhaps in behavioral health, as Ben just highlighted a little bit of. So the idea was to not reinvent the wheel, but to compile practical, easy to use information and tools that are already out there. So you'll see throughout the presentation, and then also when you actually hopefully have a chance to look at the toolkit, that there were a few primary sources of information, but we really used a wide variety of them. And then the biggest caveat I want to say is that the toolkit is really meant to help organizations. It's not meant to address those broader system level issues like there's not enough places in training programs and, reimbursement rates are too low and, other things around wages and some more systemic things. It's really meant to help organizations in their recruitment and retention practices. So with that caveat, next slide, please. The developing the slide number, oh, there we go, thank you. So just really quickly, we developed the toolkit in three phases, and I didn't see all the names on the call, but some of you might have been involved with this because we tried to include people from all over the state. The first phase was we had like key informant interviews with 11 providers from around the states and different types of behavioral health organizations, both mental health and SED, and some organizations that provide services in both areas, to find out what are those organizations or those individuals' biggest challenges when it comes to recruitment and retention, and also what are their biggest successes? What were they doing that was like working? And then we developed an outline of the toolkit, and then we held 3 feedback sessions to get feedback on whether this outline, this proposal we had was going to kind of be the right approach. And we got some feedback on that. It was super helpful. And then we built the toolkit based on all the tools we found online, and a handful of providers, 7 of them, provided a detailed review of the draft toolkit and gave us some very helpful suggestions that resulted in the toolkit that's now available online on the HCA website, which I'll give the URL at the end of the talk. Or if someone's itching for it now, maybe someone else who knows the URL can post it. Okay, so next slide, please. Okay, thanks. So there are 5 sections. The first one is about organizational readiness and capacity, and this is really about using qualitative and quantitative data to see how are things going now, what are our biggest challenges, what are our priorities, how do we measure what our priorities are, and then how do we keep measuring it. And the idea here is not to eat the whole elephant at once, but to set a few key goals at the beginning and to see where you can collect data and create some goals. And then section 2 focuses on recruitment, getting the word out and getting the most applicants, getting the most qualified applicants that you can. And then selection, the process of picking the best candidate, the best for your organization, and then also where there's goodness of fit on both sides. And then section 4, retention. Personally, that's my favorite. I personally think that's the most important. The biggest key to this puzzle is retention. They're all important. They're all super important. I think once you have people who are succeeding and experienced and doing well in your organization, you really want to keep them. And then the appendix has a list of resources. And one thing I should say, this toolkit is 17 pages. So it's meant to be very digestible, but it also has lots of links. And some of the links we try to target to specific tools rather than to, go read this 55-page document. It's more like, hey, look at page 22 and 23. It has this tool on how to do A, B, and C. So we've tried to streamline it, but because we didn't want the whole thing to go into the too hard pile, we tried to keep it really streamlined and doable. Next slide, please. So, maybe it's just delayed for me. I don't see the next slide, but I can see Danny working on it. So I think, excuse me for a second.
Cheryl, you're still muted.
I'm the one who's muted. I thought you were talking to Danny. I'm so sorry. Okay. Each section has an overview and the important points to consider and best practices and tools, some links and some ideas of tools you can use. And then depending on what your organization, what's most important to you, you can use just one section, just recruitment or just retention, or you can use the whole toolkit together. And then the appendix has lots of links to different resources. But just one page with links, that doesn't go on forever. We've, like I said, tried to keep this doable. Next slide, please. So assessing the first chapter, or the first section is assessing organizational readiness and capacity. And the idea is to identify which are the recruitment and retention challenges that are most pressing for your organization. And then to focus your limited capacity, because if you're running a health organization, healthcare organization, or behavioral health organization, you don't have unlimited resources. We know that. So pick the ones that are your highest priority or the most challenging, and then focus on what strategies will affect those. So you're using your limited resources in a focused, the most productive way possible. And then use any data you have, whether it's qualitative data, word-based data, stories, information from current employees, or whether it's quantitative data, turnover rates and things like that. And then again, the focus on just a few key metrics that you can track over time, given your limited capacity and the priorities for your organization. Next slide, please. So the first, oops, sorry about that. The first the first component of the readiness that we'll look at is the quantitative data considerations. So if you look at the numbers, you can look at numbers such as the annual percentage turnover rate, or the percent of staff who leave within an X amount of time, 6 months or 12 months or 2 years, or whatever's meaningful to you, or certain positions, or the average salary by position. And it can be super helpful to compare to state or national data, and maybe perhaps, especially in communities like yours, like if you're in a rural community, you want to compare to other rural communities. And both Relias and HRSA have some national data information, and then the Workforce Board here in Washington State has some state data. And then SAMHSA has a recruitment and retention toolkit, and it's amazing. It was created by Advocates for Human Potential, but 2 caveats about it is it's huge. It's really, really big, or 3 caveats. And so it might be helpful to go to specific targeted places that we outline in the toolkit, because it can be overwhelming when you look at it. The 2 other caveats are that it's big, it's a little bit outdated. It's not super outdated. I think they talk about Craigslist instead of Indeed. There's some things that feel a little like maybe they're dated. And if you look closely at it, it seems to focus a lot on federal jobs, but their concepts and their themes are very applicable to all sorts of employers. So anyway, they have a nice little tool to help help with some of the quantitative calculations that your organization might not already be doing. But I highly recommend checking out the SAMHSA toolkit, the Advocates for Human Potential toolkit, if you haven't already. Next slide, please. In terms of qualitative data, there's lots of things that I'm sure your organizations are already doing. Maybe you're doing some of them and not other ones, in terms of getting feedback from your employees, whether you're doing internal self-assessments or bringing in a consultant or doing some team evaluations or interviews with employees or surveys with employees. But those types of activities obviously provide really good qualitative information. And especially if you couple it with the quantitative information, it can be very powerful and help you set your priorities. And then one of our primary sources, in addition to the SAMHSA toolkit, was this 10-Care Workforce Initiative toolkit, and 10 is Tennessee. And it was actually, even though it was developed for Tennessee, it was developed by researchers at the University of Minnesota, and there's lots of great tools in there. And if you look at our toolkit, the toolkit for Washington State, there's lots of links to specific tools within the 10-Care initiative toolkit. And this one in particular is helpful in terms of figuring out how to gather the qualitative information that helps you to figure out how you want to put your energy forward. Okay, next slide, please. And then once you kind of figure out what you want to focus on, the idea is obviously to match your strategies so that they align with the challenge that you're trying to address. And the image in this slide is just one small part of a much longer table that has a variety of different types of challenges, and then some different strategies you might consider to address those specific challenges. And so on our toolkit, this is on pages 6 and 7. And if you were to go to the 10-Care toolkit, it's on page 22. And that other toolkit's 30 pages. It's a little bit longer. But this is just an example of the type of tool that you would find. I'm not going to go into details about it because I think that that's A, I don't have time, and B, I think I'm just more introducing the toolkit to you so you could go and take a look. Okay, next slide, please. Then the next section is about recruitment, and I know this is an area where people have a lot of experience, and just want to briefly say that some of the important points in recruitment, some of the best practices, out there are, it's really important to describe the position very clearly and concisely. And one thing that you really want to do is, especially in entry-level jobs, but really in all jobs, but entry-level jobs, you really want to avoid too much behavioral health jargon or lingo specific to your organizations. Some of you have probably had experience applying for jobs and thinking, like I have had this experience, like I know this means something to the hiring official, but I have no idea what they're talking about because it's words that organization uses that other organizations might not use. So kind of maybe have it proofread by somebody outside your organization or someone who doesn't know all the lingo and jargon. And it's really important to describe what your organization is a great place to work. Why is it different than other organizations? What makes it particularly great for employees? Along the lines of some of the things we heard in the comments during Ben's presentation. And then you really want to develop strategies to get the word out. You want to invite engagement with the potential applicants. You want to invite engagement with the types of applicants that you're hoping to attract to the position, and get your job announcement into the hands of as big a pool as possible of the types of people, meaning the types of experiences they have, their approach to work, their approach to working with different types of populations that your organization might be providing services for. And then this last bullet on the slide is one of my favorites, which is asking all of your employees, all of your board members, all of your community partners to kind of share information, like a all hands on deck. Hey, we've got this position open, whether it's a very entry level position or a higher level licensed position, whatever. It's really trying to get the word out because people who are connected sometimes have similar interests or approaches to work, and it might get you the types of candidates that you're most interested in. Next slide, please. So this slide talks a little bit about what I was talking about in the last slide about why is your organization a great place to work. Some communities and organizations, so now I'm talking about both communities and organizations, have both professional and personal benefits. Like, oh, our community is a great place. If you really love fly fishing, come and work with us. Or if you love, skiing or cross-country skiing or whatever. So whatever's really strong in your community, maybe there's great crafting circles or, whatever might attract people to your organization and or your community, both professionally and personally. What people find rewarding about working and or living in your community. It's important to be very explicit about that. Don't be shy to say what's great about working at your organization or what's great about living in your community, especially if you're in a rural community or a small town and you might be trying to attract people who have been living in urban areas for their professional training or whatever, and it's a big change for them to go and live in a rural community. Some people would really love that if they understood the benefits of it. So the urban versus rural, and then the business types of people might really love the not-for-profit or the for-profit environment, the different maybe vibe or energy in the different types of organizations or governmental organization. And I know it's a big problem is that the not-for-profits can't pay as much, and then people or smaller systems, smaller healthcare providers, of course, can't pay as much as the larger systems and the governmental organizations. And then the cultural and linguistic background of the community served, that might really help to attract people, whether or not they're part of that community, they might be very interested in serving or working with that community. Okay, next slide, please. I'm not following the chat at all, and I see there's a number there, 7. So if I should be interrupted at all, please feel free to interrupt me, otherwise we can address any questions that have arisen. So the Advocates for Human Potential has tools for job analysis. So a job analysis is hang on a second, lost in my flow. Um, as a little more detailed look at a job. Oh, that's a job. I'm sorry. I'm sorry. I think that the chat thing got me off my flow. So anyway, the Advocates for Human Potential has really good tools for drafting the types of clear job description I was just talking about. And then HCA has a new tool. Maybe some of you have seen it. I think it's been around for less than a year, but they've got lots of great like images and verbiage and other assets that you can use in your recruitment efforts. And it's all available for free online at this link. And then the link is obviously also in the toolkit. And if anyone's interested in the link, you can ask for it in the chat. And I'm sure I can get it for you later or someone else can. And then this Relias has this 24-page ebook, How to Become an Employer of Choice. And it's short enough, I think, to not be too hard to find time to take a look at. It's got really great information and tools and ideas about how to like make your employer, your organization stand out as an employer of choice. Next slide. I think because it's already been 20 minutes, I want to leave time for questions. I might slide through this because a lot of you already know about this, but the main thing I want to point out here is that it's the goodness of fit thing I mentioned earlier. It's, I think, easy for job seekers to think like, oh, I really want them to like me. I really want them to like me. I want them to want to hire me. And then as an employer, it's really easy to think, oh, I really want to like this candidate. I really want to like this candidate. And I think it's for getting back to retention as the key. Recruitment is part of retention. That it's really important to find goodness of fit so that people stick, so that they have a realistic view of what your organization is, what your community is, and what the job is. And next slide, please. Which is, I think the next slide talks about job previews. That's no, not that. Using I think everyone knows that panel interviews are probably like the best way to go in terms of getting diverse perspectives within the organization. So it's not just a top-down decision on who is hired, but peers and sometimes even people who would become subordinates of the person who's hired. It's good to have their input on picking the best candidates, who's good as a fit. And if you're going to use panel interviews, it's very important to have clear criteria so that at future panel interviews, people are selected, they understand why they've been selected and what their role is and what the criteria is for putting them on the panel, and have standard set of questions. Everyone should be asked, the same questions to make for equity and to make sure you're soliciting the information you need. And having a structured rating scale, so it's still subjective. You can't take away subjective, of course, but a structured rating scale to get a little bit closer to objective because you're using a structured scale. And then make sure you don't have, too many questions or too few questions, but a good number of questions for the type of position that it is. And then structured behavioral interviews, some of you are probably familiar with this. The idea is the best way to ascertain how someone will behave or perform in a job is to learn how they have behaved or performed in similar situations in the past. So asking like a scenario type questions regarding, if this and this happened, how have you handled it in the past? You learn about a person, whether they're a good fit for your job, regarding how they think through challenging situations and how they have thought them through in past life or professional situations. The job preview, this what I was stammering over myself a couple slides ago. I was thinking about the job preview. This is a tool that some of you might already use, but it's more detailed than a job description. And this is especially helpful for entry-level jobs, for people who are new to working in the types of positions or the types of organizations that they're going to work at with you. But it's more in-depth than just a job description, and it really gives a day-to-day view on what a job would look like. And it could be a video, or it could be in writing, or it could be done, orally while you're in a meeting with someone, but really like a preview of what does this job look like. And this is a big part of the recruitment is connected to retention philosophy, so that when people are hired into a job or accept a job, that they know what they're being hired into, they know what to expect. It's not like 2 months later, they're like, oh my gosh, I had no idea. how hard this was going to be or how challenging, this aspect or that aspect of the job would be. And the 10 Care Workforce Initiative Toolkit has a really nice job preview, some information on that to help put together a job preview. Next slide, please. And then retention, like I said, this is my favorite, most important part of this whole recruitment and retention thing. And there are 3 main points in retention. One is your strategy for onboarding and training. That's a huge part of retention. Then the approaches to gathering input from employees, and then of course couple that with what you do with the information, and then the tools to promote organizational employee growth and well-being along the lines of the type of things we talked about during the comments and questions part of Ben's presentation. So next slide, please. So onboarding, some organizations think of onboarding as what happens on the first day or maybe the first week, but really a strong onboarding program is several months long, 3 to 6 months. And the idea is to create support so the person totally understands the organization they work for. It builds affinity and affiliation, and it builds commitment because they know what's expected of them and they know what to expect and they know how to ask their questions and feel more a part of the organization. And one study showed that employees who received this strong structured onboarding were 58% more likely to remain in their position 3 years after hire. So 3 years, and at least in behavioral health, 3 years is a nice long time. So so onboarding is super important. And next slide, please. And this just has some examples of important onboarding things. I won't go through it because it's a fair amount of detail and there's even more detail in the toolkit, but having a checklist, maintaining the contact with the person after they've been hired, scheduling structured check-ins, a peer mentor or a buddy program, having an experienced employee. They don't have to be a mentor like a professional mentor, more like an organizational mentor. Like, here's the things you need to know to work well in this organization. So you don't spend, 2 hours learning the correct way to fill out your timesheet. That shouldn't take 2 hours, but someone who kind of helps you walk through some things. And then ask for feedback from the new employees. How's it going? What additional information do you need? And then the last bullet is, if you have remote or hybrid employees, they probably need some special attention, especially regarding the whole kind of belonging, the affinity, affiliation, part of it. And then also they might need some more enhanced IT support for those remote and hybrid employees. So you don't want them at home pulling their hair out because they can't use their computer. We get enough of that if we work in the office. So gathering staff input, super important. Everybody knows that. There's different ways to do it, and there's some ideas in the toolkit, and then you probably have your own ideas. It's good to offer a variety of ways because different people will respond to different types of ways to do it. And, do it at regular intervals. If it's every 5 years, that's not really, good enough probably, but some regular period of time that people can anticipate. And then what's really most important is not collecting the feedback, but what you do with it. And it's highly recommended in the toolkit that to either accommodate or whatever the word is, make changes suggested, or if there's trends and you're hearing several things over and over, but as an organization, you just can't do it or can't do it yet, it's good to, report back to the employees, we got this great idea. It would be so great if we could do it. We can't do this now. And this is why. And, we'll continue to look at this idea, especially if you're hearing it over and over. Next slide. So these are just some templates, some ideas on collecting that input, that qualitative input. And this is one of my favorite ones, the stay interviews. So we all know about exit interviews, right? Hey, you're leaving. Why are you leaving? What did you think of working here? What worked well? What did you think was different? Blah, 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 that stuff. This is kind of the same thing, but this is for people who are staying. I wouldn't suggest connecting this with the annual performance review process because that's so fraught. You probably want to keep those separate, but really interviewing people who have stayed and find out why, what's working well, what do they wish was different, what would they recommend your organization as to friends to work and why, and kind of just gathering that information. And then there's an organization called the National Rural Health Resource Center, which has this particular template. But every organization is different. So these templates that we point you to, they're really just models. And if you use them, you should adapt them, of course, to your organization, your community. Okay, next slide, please. I'm almost done. Oh shoot, it's 10:30. So the employee well-being, I hate to give short shrift to this because it's so important, but this is about organizational wellness. This is about the types of comments we heard during Ben's presentation, how it's really important for people to feel valued at work, like they belong at work, like their colleagues care about them, they care about their colleagues, they care about the organization cares about them. So it's just a huge part of retention and an organization leadership management. The people, kind of more at the top might think they know what would create the best sense of organizational well-being, but really input from staff should be driving that, because what's important to the managers and leaders might not be important to the line staff. So it's really good to take that input, take it to heart. And then the last slide is a SAMHSA resource about using are you able to go to the last slide, Danny? Or whoever, sorry, Danny, I don't know if you're the one doing the slides. The last slide is a SAMHSA resource about, there we go, about employee well-being and using the idea of using a trauma-informed framework. Because many of you, I imagine, when you're working with your patients and clients, use a trauma-informed approach to care, and this is about using a trauma-informed approach to management and leadership. And whether you're in general healthcare or behavioral healthcare, our employees, the staff have exposure to suffering that accompanies their work that creates a traumatic that can be traumatic, and that taking that into account as you build employee well-being programs is will lead to better retention, will have its rewards. So that's my last slide, except questions. If you feel free to reach out to me anytime. My email address is on the next slide, and the URL for the toolkit. And I think, Danny, you wanted to wait and do questions for both the presentation as well as Tasha and Melena's presentation, or did you want to do them separately?
Yeah, I think in the interest of time, let's get Tasha and get them rolling, and then we'll have time for questions at the end. So thank you so much, Cheryl. It was such valuable information. We are so excited, and we will I'm excited to introduce the next presenter. So I'm Milena Stott is a health and housing systems expert holding numerous titles within the industry, including Chief of Strategy, Chief of Transformation and Innovation, and Director of Healthcare Integration. Milena Stott has executive leadership and direct operations management experience in King County's federally qualified community health centers and community behavioral health agencies. Since 2019, Milena has been the Engagement Policy and Technical Assistance Specialist on behalf of the Fletcher Group's Rural Center of Excellence, assisting rural communities to create affordable and sustainable housing for those who are newly in recovery. In her role as board member for the Washington Alliance for Quality Recovery Residences, she helped develop training and toolkits to allow for the development and expansion of program models and health and housing partnerships. A duly licensed clinician, her relationship skills and systems approach are especially useful in addressing challenges in under-resourced communities. She earned bachelor's and master's degrees from the University of Illinois and an executive certificate in social impact strategy from the University of Pennsylvania. And joining Milena will be Tasha Irvin. Tasha Irvin is a leader and strategist with 17 years nonprofit and 17 years corporate experience. Tasha has a long track record of successfully analyzing problems, building solutions, and helping the community with data, ideas, and partnerships. Her expertise encompasses human services, healthcare, education, technology, and consumer products across corporate consulting, agency, startup, and nonprofit settings. For more than 6 years, she's consulted with nonprofit and mission-driven organizations, primarily in the human services space, to develop sustainable programs to meet our community's most challenging problems. After serving as a legislative assistant in Washington, D.C., Tasha has enjoyed weaving government relations throughout her career. She received her bachelor's from Stanford University and her MBA from the University of Washington. So, Tasha and Melina, would you like to try sharing your screen? I can stop sharing
Yeah, that'd be
and
great.
see if it'll allow you to.
Danny, thank you for the introduction, and we will try doing our share here because I know that might go more smoothly. All right. So I'm going to share and then launch. Hopefully.
I can see it, Tasha.
Okay, I'm going to go into full mode. All right, we good to go? All right, so we are going to be presenting on a tool that we, as Principal Allies, the consulting firm, has developed in conjunction with Cheryl at the Behavioral Health Institute and the Healthcare Authority, and Todd Jensen's on this call. So this is the SUD Organizational Development Assessment, but you'll hear us refer to this tool as the SODA because we felt like it needed an acronym with that mouthful. So we're going to walk through how we came up with this tool, what the uses of this tool are, and how you can access this tool for your organization. And so when we refer to SODA, we're referring to the tool itself. So the overall goal of this tool was to support SUD organizations in increasing their quality and the efficacy of their treatment. And we realized that there are a lot of things that have to come into play to ensure that there is good SUD treatment available. And those things are not just some of these workforce issues, and they're a large part of it, but there are also other organizational issues that are needed to support workforce success and just overall success in giving people the SUD recovery treatments that they need. One thing that's unique about this tool, and there are other organizational assessment tools out there, you might be familiar with the integrated care assessment. This one is geared uniquely at the needs of SUD agencies, and we developed it in conjunction with SUD agencies. And sometimes they kind of end up being a little bit of a second thought in behavioral health, in the world of behavioral health. So we really wanted to give SUD providers a little bit more attention in this space. So, like I said, this project was developed in conjunction with HCA and the Behavioral Health Institute. And how it came up was we were working on overall efforts to advance SUD treatment quality. And one of the things that we did was we looked at what are some of the training and technical support needs that those organizations required in order to have their staff be more effective in providing quality SUD treatment. But we realized in providing providing the training that a lot of factors needed to be in place in order for that training to be effective, to stick. If you train someone that then leaves the organization, that only does so much, as we've kind of learned throughout the course of the morning presentations. So we really identified a lot of barriers in advancing SUD treatment quality. Recruitment and retention was key among them. We've also heard this come up today, this inability to capture reimbursement for services, with challenges with credentialing and contracting, infrastructure barriers, variety of things that we knew that needed to be supported in order for us to provide and the system to provide effective training and technical assistance. So what we ended up doing was taking a step back and looking at how do we identify the barriers that might be unique to an organization that help them figure out where they need to put attention and invest resources to benefit from other training and quality improvement interventions. So one thing that we saw was that and we've seen this today too, that these barriers can be really unique across the system. I mean, can be really unique to organizations across the system. Like there might be some overall themes, and oftentimes those themes are systemic themes, but then each organization also has things that they want to identify to draw attention to in their quality improvement efforts. So we developed this tool starting in 2023. We developed the tool first through some initial stakeholder engagement, and then we actually piloted the tool with 4 organizations last year, and we made sure that it was a broad cross-section. We had 2 rural and 2 urban organizations. We had organizations that had tight relationships with other behavioral health providers that were maybe that we piloted with a government related organization, just to kind of see how this tool resonated with these organizations. And what we found was that it resonated very much. And what helped even more was, or equally as much, I would say, is the ability to use this tool as a conversation starter in these cohorts of SUD providers, to help them identify their quality improvement initiatives, but then also to share best practices across organizations. So we found that cohort model of going through this organizational assessment was very useful, and we're hoping, as we continue to evolve this tool with the Healthcare Authority, to provide some additional opportunities for cohorts to go through that. And we'll address that at the very end of this presentation. So just to summarize some of these barriers, I alluded to them before, but I think we all know that, and again, it's alluded to many times in this presentation, that if we don't have adequate treatment funding, if we don't have adequate workforce to provide treatment, if we don't have the capacity to implement quality improvement and curriculum infrastructure, we're ultimately not going to get the SUD treatment results that we need to ensure adequate healthcare in the system. So really our goal was to kind of facilitate this cycle of quality improvement through providing this tool. So one of the things I wanted to walk through before we introduce what the tool does to you is just some of the things that came up in our piloting of the tool and our initial reviews with stakeholders. Because when we first set out to create this tool, we really saw it as an internal quality improvement exercise that an organization could use, and then use that to reflect on their own internal initiatives. But we realized that there are all these other benefits that came up that we wanted to just point out and see if any of these resonate for your organizations as well. We found that because we're benchmarking qualities of the organizations against best practices, this turns out to be a really good exercise if you're preparing to go through a credentialing exercise or credentialing process. We also saw that this was a really helpful exercise to go through maybe at the beginning of a strategic planning or budgeting process to help you determine how to invest time and funds. Should we invest more time or investment resources in training, in salaries, in workforce benefits? There are all sorts of things identified in this tool. Again, it gives you kind of a checklist of best practices. So if you're about to start up a new organization, there are a lot of up and coming SUD organizations that are trying to meet the growing need, and particularly smaller organizations that may not have access to the resources of a large established organization. It's really nice for them to have a checklist of these are things that you need to consider as you create your SUD organization. So we also were finding on the other end of the spectrum with more mature organizations that this provides a really great opportunity to demonstrate to MCOs and payers that they're ready for value-based payments, VBP. because again, best practices are outlined and allow you to show your progress towards those best practices. They might be data collection practices, for example. We also saw that this assessment was a really good tool to go through maybe two organizations side by side to determine whether there's opportunities for partnership. Sometimes a partner might be needed in order to fill a role in your organization that you can't hire indirectly. We certainly see that as being a way that people are meeting the challenges of workforce right now, is by just partnering with organizations that are able to do it, and it might even be kind of a remote type of partnership. And then finally, this highlights topics, just areas that are of highest need for intervention. And we found that this is helpful. A lot of organizations are managed by a board of directors, and being able to take this assessment and communicate to your board or funding organizations. These are the things that we're finding are the topics and areas of highest need. That's another use for the tool. So really, this tool is yours for taking and exploring, and we've just found that the uses were far greater than we anticipated when we first started piloting the tool. So there are three primary components to this, and we will share how you can access this at the end of the presentation. There's the actual assessment, which is the SOTA tool. And that goes through 29 questions, and it gives you benchmarks so you can kind of measure yourself against standards in each area. There is an implementation guide that walks you through how to administer this, and it can be even though we've done it in cohorts, we've also set it up so that you can do this as a self-administered, confidential within your organizational assessment. And then there's a scoring and planning tool. And what that does is says, okay, given these were it helps you calculate your scores. And then it says, okay, given that these might be areas that require attention, these are some tools that we would recommend to help get you started on a quality improvement exercise based on how you scored. And you will not be surprised to learn that the recruiting and retention toolkit that Cheryl went through is one of the recommendations in the recruiting and retention area. All right, so just to overview the domains for you, and then my colleague Milena is going to kind of help me go through these in a little more detail. There are 6 primary domains, and they really are organized from kind of macro organizational level issues down to much more client-centered, treatment-centered issues. So we know that in order to have a foundation, you need to have a strong foundation in order to provide excellence in treatment. So we start looking at organizational leadership and infrastructure issues, then we delve into finances, workforce organizational readiness factors, and then looking at the staff growth and development, services that are actually rendered, and the ability to address whole person health and partnerships within the community to address some of those issues. So again, looking at getting a little bit more deep into what we're measuring, and we'll show you a little bit of a sample of the assessment. Under organizational leadership, these are some of the issues that we look at, and in the interest of time, I don't think we can go through all of these, but you'll see that they really range from what is the experience of your leadership to how up to date are your policies and procedures and your licensing and regulatory requirements, how well they're met. And so you'll have access to this presentation. You'll kind of be able to see, why we picked these topics. And this was all developed with literature in the space about what leads to a quality organization and ability to deliver SUD services. So we looked at organizational leadership. We looked at finances, and again, this has come up again and again. Does your organization accept public insurance, private insurance? How much are you relying on one-time funding or grant funding? What practices do you have to review your fiscal strength over the course of the year? And how good is your overall, or strong is your overall financial position? What happens if a crisis like COVID comes up and you need to make sure that you can keep your doors open? So these all contribute really to operational stability. So we've started at these macro levels, and then my colleague Milena is kind of going to overview the more workplace and clinical aspects of the assessment. So Milena, do you want to take over?
Yeah, thank you, Tasha. Everybody can hear me okay?
Yep.
All right, great. So in order for you to be able to focus on workforce recruitment and retention efforts, a lot of those foundational pieces need to be in place. And so, like Tasha said, we go from the macro level, the supporting factors that influence those things, to how you execute them in the organization. So assuming that, there are strong foundations in place, the next logical place to go is kind of workforce culture and how your organization pays for staff and helps develop and retain staff. When we talked about the retention toolkit and when we talk to staff, they feel that, they want to stay in organizations where they feel satisfied. A lot of our organizations are similar to one another, and what really differentiates one where somebody may stay longer is really their ability to relate to that organization and the positive impact that they're able to have on clients, right? So next slide, please. So the organizations that have a lot of those foundations in place are then able to focus on the clinical staff growth and development. So aside from salary, investing in training and making people feel like they're part of a team and that their team is working and meeting the outcomes that, that they're trying to achieve is ultimately what keeps staff satisfaction high. And really also manages risk and helps clients get better, which is, what we're all in the game for. And if we're using this training, like we talked about in our cohorts, we're training these folks on evidence-based practices. We really want to retain them in the organization so that they can begin to implement and use those skills. And staff who are being invested in this way are staying in organizations longer. It's kind of like the virtuous cycle, right? Once we get the foundation and the systems in place and we all understand our roles and are working in unison, we're moving towards those outcomes that we want to see. So this next area is a direct impact of that, right? That staff who are trained well and understand the system components, they're able to deliver good clinical services. Within that, you're also looking at quality management and supervision practices. And how are you collecting that information? How are you helping adapt to the needs of your community? In that it's not a one-size-fits-all model, but you're using this integrated knowledge and these conversations and these management practices and these metrics to really study and make sure that what you're doing is working well. All right, next slide. Sorry, I'm cruising through this and I just want to make sure that we get through it all. So once you're able to address and provide the quality service, right? And this is what we see in organizations and what the system calls for is you're able to then really focus on addressing those other domains of health. And more we're looking to contract for networks of services that provide these holistic supports to folks. So what else can you do other than the holistic care is really how are your care coordination and referral and partnership practices in that if you can't provide it in-house, how are you working to make sure folks have access to it, knowing that access to those things impact your outcomes and metrics. All right. So in terms of the implementation guidelines and how you use this assessment, really, we recommend that you look at cross-functional teams. So depending on the size of your organization, you'll have to kind of, scale the size of the team based on the size of your organization and what you do. But what we recommend is different levels within the organization, or if you're only doing a specific program, making sure you get staff input from that program, but who carries the helpful information that you want to know from the different teams and the different levels. 2 90-minute sessions is how we did it in the pilot sessions with a follow-up planning session to really synthesize the results that you got from the assessment. And then really use it as an annual benchmarking tool, right? Look at what you did last year and what came up last year, and how have you used that knowledge to advance the strategies that you wanted to focus on. Though it is available on the HCA website and fillable through there, there's no requirement to share it with the HCA. So we want to stress that you can use this in whatever way suits you. Some folks have used it, for example, to guide conversations with boards, to help the board understand the challenges that are up and coming for the organization in the coming year, especially since our funding landscape changes so quickly. Next slide. So this is a little bit of what it looks like if you were to click on the link that the HCA has available. You see here domain 1 and the practice area, and then the scoring. So there's basically, those are the behaviors that you would see in an organization. Now, sometimes people are in between 2, they're between a 2 and a 3. So a 0.5 is okay. The more important thing is that you're using the notes section to discuss why it's not, the higher number, because that'll help you in understanding that kind of next step that you have to get to that number. All right, next slide. So this is the domain 1, all scored. Now, the percentages and the scores don't necessarily mean anything. It's what's in between, right? So if I look at this one, I'm like, ooh, okay, so they're doing really well in strategic business planning, but the service accessibility, there's something going on there. Well, maybe there's a relationship between service accessibility and business planning. For example, there's not like a fund source for something that you want to do to increase service accessibility. But that's now information that you have that's really, targeted, that if you want to increase that score, that's something you're going to have to look at. Next slide, please. So then along with each area, you can make notes around dependencies. So that's like really relationships that, between the different variables. And then there's also an accompanying toolkit. So these are toolkits related to each of those domains that provide a good overview or foundation for you to look at and explore what it would be like to advance that practice area. All right, next slide.
Weird.
Yeah, I guess it didn't download. That is okay. I might actually.
So the first one is basically using the SOTA to identify the areas, yeah.
Right, that you want to focus on, and then you really use the tools to think about, okay, well, what targeted training or technical assistance or initiatives do I need to put forward in the organization, and who needs to be part of it? Oh, look, it came up. Use aggregated organizational assessment data to identify system barriers, right? So there may be things that are out of your control that you need to elevate to your board and others in your community, with the ultimate goal of how are we using this information to drive conversations that increase our quality of care and lead to SUD recovery outcomes. And here are your links. So in the 3 minutes we have, happy to answer questions, but of course, our contact information is below, and we are happy to hear from you outside of this meeting. Thank you so much, everybody, for your time and for being here today.
I'm just going to make one note, Milena. I'll put this link in the chat, but the HCA is still working on publishing the links. So you'll probably, if you go to the site, you won't see the links to the tools today, but we're hoping that those will get uploaded in the next week or so. So just wanted to make sure if you do not see them live yet, that they are coming, but you can always contact us with questions. Stop share.
Well, thank you so much, Tasha and Melena. That is so informative. What a comprehensive toolkit there, assessment tool, and I hope that many people here will be able to take advantage of that and use that tool. We do, in the interest of time, we are going to wrap up, but the slides from today will be shared out after within the next few days with all the contact information for all of the presenters. So if you have a burning question, you can feel free to reach out to them. I do want to share just a few quick things as we wrap up here. We wanted to let you know that we will be the next Learning Collaborative will be in July. We are taking June to do some strategic planning and recruiting of quality presenters for the rest of the year. And then we do have a link for some feedback for today's session that I will post in the chat so that you can provide feedback about today and request any future topics. But other than that, we hope you have a wonderful day. Thank you again to our wonderful presenters. We really appreciate you. And thank you everyone for attending.